For over 7 years, Republicans in Washington have cheered shortcomings in our healthcare system and blamed the Affordable Care Act for every problem under the premise that they would do so much better if just put in charge. Repealing the law made for great bumper stickers, great campaign promises. But the trouble is that their opposition to the ACA has always been more about politics than it ever was about actual policy, or for that matter, plans to do better for the American people. The shockingly rushed and secretive effort on display this week in the Senate is only further evidence that President Trump and Republicans in Congress don't have any real solutions to improve our nation's healthcare system. After months of negotiations behind closed doors, Senate Republicans released their secret Trump Care bill. Its contents proved too harmful for passage, even among themselves. Now stuck without a path forward, their latest idea is to pass a small backroom deal before sundown today, which no one has seen yet, to then go to conference with the Tea Party and the Freedom Caucus in the House of Representatives. While we still don't know what we'll be voting on, we know that the so-called skinny repeal bill would mean higher premiums and millions of Americans losing their health care coverage, not to mention deep cuts that would dismantle the Medicaid program as it currently exists and throw millions of Americans off their health care coverage and put our entire health care system into chaos, all to give a massive tax break to the wealthiest among us. That is just awful policy any way you look at it. Since January, I have heard from literally thousands of New Mexicans who have told me how important their health care coverage is to them and to their families. What answers do President Trump and Republicans here in Congress have for the grandmother in Santa Fe who wonders where she'll go when her nursing home closes because of Medicaid cuts? Or the woman in Albuquerque who wrote to me about how scared she is about losing access to mental health care for her depression and anxiety? What are they going to tell the single mother in Rio Rancho who relies on Medicaid to cover her children's medical costs, or the young man in Espanola who needs treatment to get clean from opioid addiction? These New Mexicans and millions of other Americans will be harmed if this bill becomes law. Look, I'm not outraged about all of this because I'm a Democrat or because of what I think of President Trump. I'm outraged about this bill because of what it will do to my constituents in New Mexico. And I will do everything I can to oppose this appalling legislation and this appalling process, and to fight to keep quality health care accessible and affordable for New Mexicans. If we can just halt this mad rush, we could all work, Republicans and Democrats, to get to the things that we agree need fixing in our system. And there is much work to be done there, no doubt about it. As Senator McCain told us all yesterday, we've been spinning our wheels on too many important issues because we keep trying to find a way to win without help from across the aisle. There is a better way forward. We can come together and work on the things that we know need to be fixed in the ACA. People's lives hang in the balance, and there are real bipartisan solutions if we can get back to regular order. I want to thank my colleague from New Mexico for his incredible leadership in this debate and say how hard we are going to work to make sure that we keep fighting for our constituents in New Mexico on this health care legislation. Thank you, Mr. President.